Thank you very much, Dean Taylor. The Dean has always been very, very supportive of our work in the Brooklyn Health Disparities Center. And I'm sure you now have a good sense of what SUNY Downstate really stands for. It's a huge resource. If you go out there to your communities, let them know that there's a huge resource at Downstate for all the schools that he mentioned and for also research. And you can get to us and then we'll be able to help you in those regards. I now take this opportunity to introduce Dr. Mark Stewart. He's a Dean for the College of Graduate Studies, and he's also the Director of the Research Core of the Center. Thank you.
Thank you. I want to share or echo Dr. Taylor's comments about how important the work of the Disparities Center is to this campus. This Downstate Medical Center is one of 4 medical schools in the State University New York system, which is one of the largest state educational institutions in the country. With 65 now campuses, 4 medical schools, it's really quite a large organism. And we cover not just the New York City area with Downstate, but medical schools in Buffalo, Stony Brook, and Syracuse. And that gives us access to a variety of disparities, not just racial disparities, but gender disparities, urban-rural disparities. And so what is so interesting to me about this center, as the only funded disparity center within the State University of New York system currently, is that we can be a resource not just for this community, but for an enterprise that really covers the entire state of New York. One example of how we've been able to take advantage to some extent of our partnership with community organizations. I see Joan Peters here in the audience. An activity of the Research Corps is a review of the current literature relevant to disparities issues that's published for all of us to review and benefit from. And Joan Peters, director of the Brooklyn Center for Independence of the Disabled, if I got that right, actually led one of our journal clubs and talked about issues that the physically disabled have getting health care. And it turns out that even in a medical center as successful as this one in terms of educating its students, we did not have very much in terms of formal programming to speak to medical students, nursing students, allied health students, residents about the challenges faced by the physically disabled. And partly a result of our discussions, which were very interesting, the ones led by Joan, we've started this year, this spring, it's actually finished, our first Disabilities in Medicine Week here on this campus. And this was a program that we got the student leadership behind on this campus from all 5 of the colleges. They brought together a program that covered physical disabilities, hearing, sight disabilities, and it was a very well-attended program. So we've been able to see the resource of the Disparities Center spill over into actually changing the educational programming here on this campus. And that's really what we've hoped all along, that research activities that take place amongst our students, faculty, our community partners, end up influencing care, education, policy, so that we can start to see more of the changes that the commissioner put up. And so this is a very interesting result and what we've been hoping for. So for those of you who might be here at Downstate for the first time, we're looking to see this kind of partnership grow and thrive. And there are real targets, right? So if you see something that needs to be studied, raise the question with us, and we're interested in helping you frame that question tightly, design studies around it with the goal of having an impact. That's the goal of all of our work. not just publications and grants, but having a real impact where we can see survival curves really do the right thing and move in the right direction. So I'm pleased to be part of this program and enjoy the rest of the symposium.